showing you how to evaluate medical records against CMS compliance. Today in particular, what we're going to be doing is we're going to be evaluating poor Bugs Bunny, who had a stroke and received some durable medical equipment, specifically a wheelchair, to be able to get around. It's going to show you to make sure at the end of all of that, all your records, that you have everything you need to make sure you are compliant with CMS. So let's get started. Let's create a new project. Let's say CMS compliance for durable medical equipment. We're going to hit create. It's going to start us in this new project. So let's make sure we have all the things we need uploaded already. So we have his required documents as well as a medical record. Inside there are all the different things, and let's check it. But here, let's write a prompt. Let's use Hathr's capability to write itself a world-class prompt to get exactly what you need. So I had this prompt already done, and we're going to hit go. Now while it's thinking, what it's going to do is think, and it's going to optimize writing a prompt to get you exactly what you need to evaluate the medical records you have against CMS requirements. Here's our prompt. Let's take this now, in the quotes. We already have our uploaded documents. And now, let's copy and paste that in here, and let's hit go. Let's do that evaluation. With Hathr.AI, you don't have to be an expert prompt writer. You have to know how to ask the tool on how it can be an expert prompt writer for you. You have all the capability for you to be able to process your HIPAA-compliant your documents in a HIPAA-compliant way to be able to get exactly what you need. So here, really quick, going through here, DME details, medical necessity, face-to-face, proof of delivery, and all these different things that you would possibly need to evaluate the compliance for a medical record. Let us know if you have any questions. Go to app.Hathr.AI to sign up for your free trial, or reach out at contact@Hathr.AI to get you started for your team.